Welcome back to Angel Vinay Nursing tutorial. In this video, we are going to study about the modern concept of pediatric and healthcare in children. So here, we are going to study about the modern concept. So modern concept means, so we have, last class we have seen the traditional or the ancient concept. Okay, concept like how the people treated the child. So here we are going to study about the modern concept of pediatric. Here, first one is it is a status not like other specialities. So here pediatric is not like other specialities and it is deals with the exciting dynamic process and of continuous care of the child. So which is not like other care like so how we are treating the adult, it is not like that. So here we will be giving dynamic process, changing process of continuous care of the child. So that is a modern concept of pediatric. So here some of the this one see some of the um, agencies will be there. So we can see this UNICEF. UNICEF we know, so that is a United Nations International Children's Emergency Fund. Okay, so UNICEF they assist the needs of the children and immediate benefit of nutritional balance. It is considered as long-term personal development. It is this approach is called the country health programming. So UNICEF means they will be gathered together and they will assist the needs of the children who need the care. Okay, they will assist the needs of the children and immediate benefit of the nutritional balance they will give the children. And here, the pediatric age group had more morbidity and mortality in developing countries. 40% of 1 million old population is constituted by the most vulnerable segment in children. So here we can see the mortality, morbidity and mortality. Morbidity means a number of diseases or disease in a population. So number of disease in a population we can say that morbidity and mortality we can say is number of death. So which is related to the number of death of children. So here, pediatric age should have the more morbidity and mortality in developing countries, and mortality, number of disease, and the number of death rate will be increased. And 40% of 1 million old population is constituted by the most vulnerable segment in the children. So there is a more chances to get the diseases or the death among the children. So the UNICEF they will give the special care to those children. So let's see what are the factors we are influencing the health problems in children. So what are the factors will why the children will get kind of disease or having disease or why they are dying? Okay, so let's see the factors influencing the problems. First one is the climate. Okay, so climate which is very important in that. So the children living in a very cold or very extreme hot area. So that climate is very important and that environment. Okay, so next one is the environment and next is the geography. So where they are living, the geographical area. Okay, geographical area means also the physical features of the earth. Then prevalence prevalence, so the fact condition being so that they are in a very high risk region. Then ecology of infectious agent, there is a more microorganism or organism present in the environment. Host, so host means you people knows what is host. Host means nothing but the parasite or the microorganism living inside the animals or plants, so we can say that host. And agricultural resources and practices. Next is education, then economy, social, cultural consideration, stage of urbanization and industrialization, gene frequencies and hereditary, nutritional deficiency, family background. So these all are the factors will be influencing the health problems in children. So these will influence the children to get the disease. Okay. So next we will move to the what are the factors influencing the health and nutrition. So these we have seen. So which will be more promote or which will make the these factors will be make the children to get disease or death. Okay. Next one which will influence the health and nutrition. So which of those things will be influence the nutrition or the health will improve the health. Okay. So here illiteracy and ignorance, superstition, and cultural, religious practice, rituals, poor economic status. These all the factors will be influencing the health and nutrition. Okay, so we have seen which is influencing the health in problem in children. Then these are the factors influencing health and nutrition. So next we'll move to the contemporary disease pattern and changing concern. So this is that not much important. You just know that's it. So here that is a one of the diagram is given. So here the morbidity diarrhea percentage they have given 2 percentage, and here the malnutrition 25 percentage, and infection 30 percentage, other diseases 25 percentage. So let's see, we can see here here it's more 30 percentage infection is affecting the children. Okay, we can see here 30, so more is affecting the children. So that is the infection. This is the first one. And second one, malnutrition. So infection means we can say any infection. So if it is common cold or that pneumonia, whatever, so all this infection will be coming under. 30%, the children will be affecting very easily. Next one, malnutrition means we can say the marasmus and kwashiorkor, so like that kind of disease, protein allergy, malnutrition diseases will be there. So that will be coming under the malnutrition. And same like there other diseases and morbidity, diarrhea disease. As I said, it's a number of disease in population. Okay, that is called a morbidity. So that is called a this one morbidity. So this is the just a diagram. You should know that's it. So here, then others we can see why that the child will get the diseases. Others is accidents, including the poisoning. Maybe unknowingly the baby or the children has taken some poisonous food. Or next one is a neoplasm like a cancer. We can say abnormal growth or the obesity. It's not under the nutrition, having more food, HIV and AIDS. So these all are the other factors will affect the disease. So next move to the following percentage children are present in our India. So how many percentage the children will be there in our India? It's a 0 to 14 years, 40 percentage, 0 to 4 years is 35 percentage, 5 to 9 years is 13 percentage, and 10 to 14 years is 12 percentage. So this is a percentage of children. And next we'll move to the pediatric nursing is a specialty. So here pediatric nursing is very important. Pediatric nursing is a specialty. Let's see the pediatric. So here pediatric nursing is a specialty. The children health problem differ from adult in many ways, and children age also influence the illness. The treatment is significantly varied of childhood illness when comparing with adult. The children need special care because they comes under the vulnerable group in society. Here Children is as a health problem different from adult. Yes, we know that. So according to sorry, compared to the adult, children will get the disease very soon. Children age also influence the illness definitely because of very young children they will get the diseases very soon. Treatment is significantly vary childhood illness when compared to adult. Definitely. So we will give the tablet or the medicine for the children. It's very this one different from the adult. Okay, so Dolo 500. So we will give to the Dolo 650. We will give to the adult, but we won't give the that much amount or the Dolo. We will give the paracetamol to the children. Okay. Then children are special care because they comes under the vulnerable group in society. Yes, vulnerable groups means they are very dependent. Children are dependent to their family or their parents. Okay, they couldn't do their work there itself. Then more recently, pediatric specialty has been raised to develop in all medical colleges. So recently, so if you are going to all medical college, there is a pediatric section will be there. And it is felt that is the spirit of partnership and shared responsibility should be developed between the limited number of the pediatrics subspecialties and the physician and general nurses. So that is a spirit of partnership and the shared responsibility. Yes, obviously. So there is a partnership should be there, responsibility should be there to take care of the children. Otherwise, so they are, if they are not take care of the children, like they are not take care of the children, then the adult means so children will get the disease and they are not bothered about the children. So next one is the IAP, Indian Academy of Pediatrics. In its subspecialty chapters to prepare the guidelines for the management and common pediatric problem. So here you can see the Indian Academy of Pediatric. They are conducting, they are prepared the guidelines for the management of the common pediatric problems. All those common pediatric problems, they will be controlled by the IAP, that is Indian Academy of Pediatrics. So next one is the subspecialties in pediatric includes. So I hope you guys are heard about the lots of speciality will be there in the pediatrics. So some are there knows about only pediatrics, so it means everything will comes under. It's not like that. In that the pediatric there is a lot of subspecialties is there. Okay, let's see one by one. So first one is the adolescent medicine. So as we know, so adolescent, young people, the adolescent people, so the adolescent medicine is there, and pediatric allergy and immunology. So allergy and the immunology, then pediatric cardiology, pediatric clinical care medicine, developmental and behavior, pediatric emergency medicine, pediatric endocrinology, which is related to hormonal disease that children will be having hormonal disease. Pediatric gastroenterology, that as we know, so that is a GIT, gastroenterology, and pediatric hematology and oncology. What is hematology? Which is related to blood related disease, hemophilia, anemia, megaloblastic anemia, and oncology, which is related to cancer. Oncology, which is related to cancer. Then pediatric infectious disease. What are the pediatric infectious disease? All the disease we can say that is it, like pneumonia or whatever TB, whatever it is, we can call it is this one infectious disease. And medical toxicology. What is the medical toxicology? So nothing but the children has taken more medicine. So it may be like acetaminophen, paracetamol, right? So paracetamol, that is this one chemical name is acetaminophen. So it is excessive acetaminophen will lead to the toxic. Then perinatal medicine and pediatric nephrology and neurodevelopmental disability. What is a neurodevelopmental disability? Which is related to the nerve. Then pediatric pulmonology, which is related to lungs. Then pediatric rheumatology, which is related to bones, all these things. Pediatric sports medicine. Okay, so these are the medicines will be, or the subspecialties will be coming under the pediatrics. Then, next we have moved to the modern concept of healthcare in children. So, up to here, we have studied that the modern concept of pediatrics. So, we have seen that UNICEF. In that, we have seen what are the factors influencing the problem and factor influencing health and nutrition. Then some of the pediatric nursing is a specialty we have seen. In that, Indian Academy of Pediatrics will become. And next, we have seen that subspecialty in the pediatric. Okay, next we will move to the modern concept of child care in children. Okay, child, how they will be cared children. First one is the health care of children. How they will take care of the children. The concept of health and illness. So, what is the concept of health and illness? So, they will mainly focus on the health. So, what is the definition of health? I think you guys have studied about health. WHO formulate the definition is health. Definition. So, health is a complete social, physical, spiritual well-being and not merely the absence of disease. That is the definition. So we have to know the complete health and we have to maintain the illness, which is not there. So the concept should know in the care of the child. Then holistic view of the health. All those way. It may be physical or the mental, psychological, same like that, physical, mental, social, all this coming the holistic view of health. Then high level of wellness, self-care movement, advanced changes in medical care, expansion of nursing role, nursing pediatric act, health policy and pediatric nurse clinician, family and child centers care, child rights to health care, child and family policy. These are the health care of children. First, so we should know the concept of health and illness and provide the holistic care, physical, mental, social, and high level wellness, self care movement. If the client is not, or the children is not able to move, and we have to give the care. Advanced changing for the medical care, expansion of nursing role, nursing practice act we have to maintain, and health policy and pediatric nurse, clinician, family and child center. So the care we are giving to, it's not only the children, we should advise or we should educate the family members and rights of the child and family and the child policy. The next is the profession of care. How we can give the care? Profession of care. That is that first one self-care. We should understand the self-care and we should teach them the self-care and child-initiated care and home health care. So the mother they doesn't know how to take care of the sick child. So we should educate them. Home health care. So here in that first first subheading will be coming that concept of the health and illness. So as I said, is a modern concept. So there are the criteria will be the subheading will be in that first one is the concept of health and illness. The concept also changing the definition of the health. The health is a state of being the absence of illness, amplifying the organic illness. So here the concept of health and illness, it is a concept means changing the definition of health. So WHO, they have given the definition. So here it's healthy state of being in a absence of the illness. So there is no problem or the no illness implying the organic illness. So that is a healthy state that. And here it can be amplified when the person can meet. So how can we say that the baby or the children? So now we are talking about the children or the child. So how can we say the baby is healthy? So it should be physically healthy and psychologically, intellectually. Intellectually means should do their motor or the intellectual activities like so, if it is 1 year baby has to be try to walk or try to talk. So that is a intellectual and psychological. Identify the mothers and parents and social requirements. So toilet training. It will be the age of 2 years or three. In between 2 and 3 years, they will train the child to how to go to the toilet. That's it, toilet training. And you will be studying in psychology and spiritual. So we will teach the children how to do the prayer. So these all the things has to be complete or has to be maintained. So we can say that the baby or the children is in the healthy. And the second, in that second, the modern concept of the healthcare should function appropriately for their age, sex, and level of growth and development, the illness, situation, and environment. Okay, so according to the age, the baby has to be do their developmental stones. Okay, so 1 year try to climb, or the 6 month it will be crawling. The baby will be crawling, and 1 year try to stand or try to walk. So all this developmental on developmental growth and they have to show an illness situation environment. So these are the modern concept of health care should function appropriately their age or sex and level of growth or development. So next is the so first concept of health and illness is over and next one is the holistic view of the healthcare. Holistic view, as I said, it's a full care. Okay, health is etymologically related to the word wholeness. It's a wholeness. The word meaning is wholeness. The holistic health implies that all aspects of the total system of individuals are in balance between each other. So, there the balance should be in the individuals and their each other. It should be completely. We will give the care holistically to the children and it should be complete. We shouldn't ignore anything. And it is a philosophy that believes in an integration, harmonious balance of body, mind, spirit to maintain the health. To maintain the health, we have to make the balance of the body, mind, spirit, and maintain the health. So this is a holistic view of the healthcare. And let's see some of the things will be coming under the holistic view of healthcare. So that is the person will get care through the following exit. How that person or the children will get the care through that it is physically, emotionally, intellectually, spiritually, and socially. So through these all that aspects, the children or the person will get the care. And so that will be coming under the holistic view of the healthcare. Next one is a high level wellness. So high level wellness here they have showed that one of the diagram. So it is easily we can identify. So that is a traditional medicine. So this is a wellness. Here the traditional medicine here the premature death was there. Okay. So before in the ancient days there is a lot of premature death. So premature means it before so pre means before. To before getting the maturity, the baby will be die, and a baby may have any disability and symptoms or the signs or is there any problem. And nowadays we can see high level of wellness. Baby is very strong. The children is very strong. Self-actualization and the growth and education. All this coming. Okay, so this is a high level wellness. And next one is a fourth one is a self-care movement. So which is coming under the modern concept. Self-care movement means it can be adopted to all level of the health illness continuum. So will coming under the all health illness continuum is adopted. So that is the healthcare movement. Self-care is a more essential component of the health education. So self-care means here we will give the health education to the family. Whether we will give the health education to the children? No, they doesn't know. So we will give the health education to their family. And the child must be knowledgeable, motivated, competent to implement the plan. Okay. If the child is more than 80 years means, so we can say, or if they know they can understand what we are saying means we can say, otherwise we will give the health education to their family, or we will give the self-care management to the children. And next one is the school children. So in the self-care, see here, if it is in fact, giving, we will give the care to the mother, and if they're older, somewhat older, we will give the self-care to the children. So school children means that they are capable enough to make the decision. Sometimes school health nurse and teacher may become a support system. Yes, school children means that they can take the decision, and their school children, the school nurse will be there, and the teachers they will teach the students how to take care of their self. Then here adolescents means they are provider of personal analysis, suggestions for improving the individual lifestyle, and they maintain mutual decision making by the help of nurse and elders in the society. So adolescents, they are the youngsters. So they know how to be in the society. So what are the suggestions they have to take and the personal analyze what they have to do, what they shouldn't do. They know there, and they maintain the mutual decision making by the help of nurse and elders in the society. They will ask the others to take the good decision. So that is the adolescent. So this will be coming under the self-care movement. And next one is the advances changes in medical care. So advances changes in medical care means now nursing profession and medical professions are using advanced changes, advanced medical knowledge, understanding of emotional response of the children, and advanced immunization, antibiotic therapy, computed tomography scan, ultrasound techniques, public health measures and education, health education based upon preventive self-care, self-help group, result in reduce the morbidity, understanding of human development, and stages of personality development throughout the life cycle. So these all the what? These are the advanced changes in medical care. So nowadays they are giving the medical knowledge, understanding emotional response of the children, and they will provide the immunization. So at the birth within the 9 days, the baby has to be get the BCG vaccine. So in the deltoid region. Deltoid means left hand. Okay, so BCG vaccine will get within the 9th day, and antibiotic therapy will be there. So these are the advanced methods. CT scan, computerized tomography, ultrasound, public health and education, health education based upon self-care, all those things, understanding the human development and stages of personality development throughout the life cycle. And next one is the sixth one is the expansion of nursing role. How we can expand the nursing role. Okay, so you have studied that nursing role. So that is a nurse has to be educator and teacher, counselor, researcher, case finder, skilled care provider, and advocate. So, first year you have studied nursing, As a nurse has to be educated to educate the client, educate the parents, or they educate their family, and teacher to teach how to do that procedure, how to maintain that cleanliness, all the things, and they will educate. And counselor, they will give the suggestions. Researcher, find out the problem, why it's coming like this. And case finder, they will find the disease or diagnosis, and they will skilled care provide at the time whatever need they will provide. An advocate, they will be as an advocate of the patient. So these are the nursing role of the this one nurse. And next one is the seventh one is the Nurse Practice Act. So some of the Nurse Practice Act is there. Each state has its own Nurse Practice Act, which describe the level of the competence of the individual nurse. The nurse should be familiar with the specialities of the Nurse Practice Act in the each state. So they should have the each level of each nurse have their own the practice. So they may some nurses will be there the OT staff, or some will be ward staff, or some are will be emergency casualty staff. So each them they have their own practice. They should be familiar with the specialty nurse practice at each state. Okay. So next one, eighth one is a health policy and pediatric nurse clinician. Department of the Health and Human Service will be formulate the plan and make policy for the provision of children's service. The pediatric nurse has a commitment to the care of children and families, which will be considered as a valuable reasons in researching the diagnostic related to group for use of in caring of children. And they have the Department of Health and Human Service will have the plan and make policy for the provision of children service. Service, they develop the Department of Health and Human Service develop the plan. And what they are doing means the pediatric nurse has commitment to care of children and families. So it's not only care to the children, they will give the care to the families, how to take care of the baby, which will be considered as a valuable resources and researching the diagnostic related to the group of use of care in the children. And next one is the family and the child-centered care. Family and child-centered, it is a family-oriented, individualized and coordinated. As I said, this they will care not only the children and they will give the family and individual and it will be coordinated. Care they will give recognizing the worth of the each person as a member of the family. This care is called flexibility and creativity in the health team. So if it is the small children, so they are not taking as a the small children, they will give the value for the family and their children. And next here, needs of under that will become needs of the child. What are the needs? Maslow hierarchy of needs. Aesthetic needs, cognitive needs of the knowledge and comprehension, creativity and self-actualization needs, and recognition and esteem needs, love and safety needs, and physiological needs of the survival and the stimulation. So this is very important. Maslow hierarchy of needs. So the needs will be coming under the family and the child-centered care will coming under the this one. Maslow hierarchy needs is very important. Then children rights to care. So what are the children rights? So these all will be coming under the modern, this one, modern concept of pediatric nursing. So children rights to healthcare. So children are the part of the healthcare system. Children rights to the healthcare include healthcare under three children through home-based interventions, special interventions to reduce the neonatal mortality. Recommendation for immediate action include the needs for the comprehensive child rights code and to include a section on children's health and national health policy. So here the children have the rights, Okay, what are the rights will be include? So it include under the three children through home-based intervention. So we will care it like a home-based interventions, home-based care and special intervention to reduce the neonatal mortality. So neonatal death. So we have to, there's a nurse, pediatric nurse has to be or stop or reduce the neonatal death. It is neonatal mortality. Immediate action include for the comprehensive child rights. So child need that immediate care, critical care. Include the child health and national policy they're giving that they say that child need immediate care. Next one is the child and family policy. What are the child and family policy? It has increased the importance in the recent years. National Center for Child Policy established by the Office of Child Development OCD in 1971. Okay, so they have formulated the National Center for the Child Policy. So what are the objectives? What are the aims will be there or the objectives of that? Then that policy, that child centered policy, so that is that objectives of the family policy assist the family and individual members to develop and to function at their optimal level of the ability. So we have to assist that the family members and the individual like children and to develop their function and their optimal level of the ability. And the advocate nurse became a coordinator. Not only they used a single method techniques for the intervention, and but also she used the problem solving method and psychological approach. As I said, that nurse has to be the advocate and has to be a psycholog to give the psychological approach, and okay, they have to be a advocate to advise them, to tell them about what all the things will be coming, all those things are what are the method can use, what are the procedure can use, all those things to be told to their family. And next one is that the child has a self responsibility for maintaining the high level wellness ex horum self care theories is there. So it's Exorum self-care theories of child is says that they have the childs are the responsibility for their maintain the high level wellness. And in that child needs some care through their mothers. The mother also need education regarding the child care, obviously. So mother need the education regarding their child, and mostly the nurse has to teach the mother regarding the long-term care of children at the time of sick. So mother need more education, more knowledge regarding the child is a very sick and it's long-term sick means they need the information, education about how to take care of the children. Okay, so this is about the what we have. So modern concept of the child care in the children. So now we have studied. Okay, so these all the main headings will be coming. So these are the concept of the child wellness and holistic view and the high level wellness, self-care movement, advanced changes in medical care, expansion of nursing role, Nursing Practice Act, health policy and pediatric nurse, clinician, family and child and rights of the child health care, child and family policy. So these all the things we have seen in this video. So if you have any doubt, you can comment and below the this one comment box. And if you want to know more about, and you can comment below. Then, if you want to tell me that if you want to know about any other topic, like whatever, if it is which subject, doesn't matter. You have to, you can this one comment below. Then I will take the classes for you. So I hope you students you understand. So if you have any clarification, please comment below, and I will be replying you. Thank you for listening.